Greetings, my name is Walt Culbertson and I am President of Connecting Healthcare, an organization I founded in 2004 dedicated to administrative, financial, and most importantly clinical health transaction success. But from the summer of 2011 to the summer of 2014, I took a 3-year hiatus from my company to become a temporary employee of the state of Florida. Why would I do that? Well, in a word, direct. You see, I first discovered the standard for secure messaging created by the National Coordinator for Health Information Technology, fortunately just known as ONC, during 2 engagements in 2010 and 2011. The first was when I very proudly served as the interim program director for the Center for the Advancement of Health IT, Florida's largest ONC regional extension center, charged with educating physicians about the adoption of HIT, including electronic health records and health information exchange. I was further honored to have been selected by my state to represent it as its technical subject matter expert working with the Southeast Regional HIT-HIE collaboration, fortunately just known as SEARCH. SEARCH had been provided funding from ONC for the Gulf states to collaborate on an analysis and recommended framework for the technical, legal, and governance opportunities and issues associated with the cross-border sharing of health information in the time of a disaster. So what's so special about Direct? Well, that's the focus of this introduction of the Connecting Healthcare presentation, Paving, a HealthEHighway, available at our connectinghealthcare.com website. I started my healthcare career right out of high school when I joined the Navy with dreams of becoming a physician. But after discovering computers, going to college at night, thanks to the aid of a guidance counselor who had suggested in 1976, I think computers are going to be big one day in healthcare. I exited stage left out the healthcare technology door at the end of my tour and wrote my first practice management system a couple of years later. I lived through the pioneering adoption days of health information technology in physician practices. During my 4-decade career, I have lived the evolution of HIT, almost evenly split between healthcare providers on one end and health plans and third-party administrators on the other. I share this history to underscore this statement. In all my 40 years, I have not seen a single capability that had the potential for more foundationally and transitionally connecting healthcare than Direct. With that professional experience, combined as importantly with what I lived in my personal life, including the 5 years my late wife so bravely fought cancer, the system, and the failure of too many engaged in her care to communicate effectively. I took one look at this picture and felt again like that kid helping to treat patients during the day, but dreaming about how computers could help doctors help their patients at night. At its core, Direct is the same simple email capability that has transformed every business on planet Earth and gotten them off the fax machine except for American healthcare. But more than just email, Direct is a messaging framework on steroids. It is exactly what healthcare needs right now at this moment to pave a healthy highway that can help healthcare transition from where we are today while also supporting the connected learning health system envisioned tomorrow. 2 doctors need to share an email regarding their patient and send patient information and a test result in a summary. Direct could do that. A pharmacist receives an e-script for 888 Vicodin and needs to contact the physician without waiting on hold forever or sending a fax that could get lost or misdirected in a stack of other faxes. Direct could do that. A hospital in Orlando has a patient visiting from Lansing and needs to obtain their medical records from the patient's primary care physician and cardiologist located in Michigan. Direct could do that. A health plan requests pre-authorization documentation from a physician to approve the treatment being prescribed. Direct could do that. A rural physician is engaging in a telehealth session with the patient in their office that is also being treated by a center of excellence 100 miles away and quickly needs to receive the updated patient records, test results, and images. Direct could do that. First responders are presented with a patient with a serious injury during a hurricane. While obtaining the patient information, they take a picture of the patient's driver's license and insurance card, and with the information on the card or via a national lookup table of health plan direct addresses, sends a message to the insurance company requesting any available patient information. The insurance company sends back a list of the patient's medications, physicians, and other information as available or relevant. Direct could do that. Those same first responders then forward that information along with their dictated notes and observations and pictures as needed to the local command center, triage facility, or hospital. Direct could do that. And a patient visits their primary care doctor, and their summary of care and other follow-up and educational information is automatically and securely emailed to the patient so that it can be included in their personal health record and shared with others involved in their care. Yep, direct can do that. And as commanding as all of these person-to-person use cases are, even more magic happens when computers help with the processing of those direct messages created by people, or for that matter, other computers. That is one of the things that sets direct apart from mere facts. The content in an email can have context, regardless of whether the attachment contains structured data or not. Direct messages can be actionable based upon that content. Faxes can't. For example, an electronic health record system that is capable of receiving direct messages from referral physicians and determining from the content not only that it's safe to act upon, but then import the contents and attachments directly into the patient's electronic health record. A patient arrives in an emergency room and the hospital EHR creates a direct message to send to their doctor, whose EHR automatically receives the direct message from the hospital and in real time responds with available patient information. A pharmacy message that's given a higher priority than other messages and is routed into the inbox of the appropriate staff member and perhaps even triggers a phone text alert. The ability to perform computer-to-computer exchanges based on a human or a program trigger that automatically creates a direct message, such as when a patient is admitted or discharged from a hospital and an ADT alert is simultaneously sent to the patient's physicians and insurance company. A patient's completed lab result that is sent in both readable and electronic format to the ordering physician, patient, and other physicians as indicated on the lab order. But revisiting my days as a Chief Technology, Security, and Privacy Officer, a big part of my love of direct is that it enables all of this within secure, trusted exchange. In this day and age when healthcare is clearly under attack by the very opportunity we are striving for, connecting healthcare, Direct by Design provides important safeguards and message assurance and availability if properly implemented. For example, message disposition notifications so that every step of that direct message's journey is documented and can be acted on based on that disposition. Direct also by Design provides security, integrity, and performance benefits, especially when using direct as a message queue framework and audit trail. And finally, not just the security and extensibility of direct, but the flexibility of it. The ability for that direct message sent by the first responder in the field to be addressed by the health plan in any manner that they can. From a customer support person that is looking at the direct messages as they come in and processing them manually. Even cutting and pasting from the health plan system into the direct message to send back to the first responder. Or a health plan that has invested in automation to be able to take the most appropriate action based on the discerned content of the message. The ability of a physician or hospital using an EHR to send the transition of care and other referral information to a long-term care facility that is just getting started with electronic health records, but does have access to a direct portal, and so many other examples. That's the transitional beauty of direct. Senders and receivers of messages can still interoperate with each other often, regardless of their level of technology adoption in the first place or what stage of HIE they are at. With the ability to address almost any healthcare communication and use case imaginable, direct is literally the Swiss Army knife of HIE. Starting the summer of 2011 and working with one of the finest teams I have had the privilege of working with in my career, we immediately set about to pave a Florida HealthEHighway. Based on experiences over many years of technology efforts across the state, the first thing we determined to do was break the challenge of the chicken or the egg HIE syndrome. Simply put, not enough are adopting HIE because not enough have adopted HIE to incent a willingness to make work and data flow changes necessary to adopt HIE. It is difficult to get someone to pay for a toll for a road still made out of dirt, and they're walking up to the toll booth. Leveraging the highly efficient and scalable direct application that Harris Corporation built using the ONC direct specifications, one of the first things we set about doing was making direct as freely available as possible to every single qualified healthcare provider in the state of Florida. We established a collaborative engagement model and outreach to the leading state organizations involved in healthcare, including partnering with Florida's 4 regional extension centers. We determined to use cluster geographic implementations in an attempt to gain enough community adoption to make that adoption relevant, leading to a tipping point of use. We established a 3-phase engagement plan, which included outreach emphasizing the urgency of disaster preparedness and snowbird state opportunities. We worked with Search to connect to other state HIEs and promote those connections and gain utilization by continually expanding direct use cases for both disaster preparedness and day-to-day healthcare. But the collaboration didn't extend to just other states. We also focused on making connections within our state and possibly even being the direct implementation for EHR vendors in Florida, or at least connecting to them. But we also knew that paving a HealthEHighway was not enough. We also had to build a few cars and those on-ramps and off-ramps. So from day one, we focused on analyzing and promoting a wide range of critical use cases beyond just delivering electronic continuity of care documents. The more that critical stakeholders who communicate every day with physicians, such as hospitals, labs, pharmacies, and health plans, to name a few, the better direct messaging would be adopted and the faster a community tipping point would be achieved. We established a Get Off the Facts campaign and promoted direct use for any secure email purpose. At the end of 2013, Florida had one of the most successful direct implementations in the nation, approaching 20,000 connected users given the direct connections between Florida HIE, Quest Diagnostics, and SureScripts alone. Florida had successfully connected 11 states, was in final testing with Arkansas, and had ongoing discussions and onboarding in various stages with 10 other states. The Winn-Dixie Pharmacy pilot was in the process of being expanded to the rest of Jacksonville, and starting later in 2014, a statewide regionally based rollout. We were in discussions with the other major retail pharmacy chains and knew that once Winn-Dixie started their statewide rollout, that would encourage the others, including rival Publix, CVS, and Walgreens, to start to adopt direct as well. It was with great pride and achievement that I was honored to represent my dear colleagues at the Florida HIE and the Search Group when I was asked to participate in a video that ONC produced in early 2014 highlighting various state consortium efforts. I shared these thoughts.
The southeastern Gulf states have a very unique need, and that is disaster preparedness.
The South, more than other geographic regions of the nation, faces our usual hurricane season and other disasters. And it really is important that we have a way for states to work together very collaboratively and be on the same page with regard to how we ultimately will move health information in the time of a disaster. As we looked at the opportunity and the roadmap, we didn't believe we could be this far this quick. But as we headed into 2014, despite tremendous success, adoption, and momentum, not all was sunshine in Florida. Like the storms and hurricanes that sometimes batter our shores, storm clouds were indeed brewing on the horizon that we had no control over and could not foresee. The first major storms were continuing change in the track of the meaningful use requirements and opportunities for health information exchange. Not only of the volume that was supposed to be achieved, but as well how. But we easily weathered all those MU storms. You see, we always knew that a singular focus around just electronic transitions of care was not going to be enough to gain widespread adoption. But going up against a hurricane, well, that's a whole other matter. Simply put, the perfect got in the way of the good. When the expected HIE governance from CMS and ONC was instead transitioned to private industry, with the many good things that could come from that, so did many disastrous wins. Without debating or laboring on those in this context, there can be no denying the extraordinary cost of those requirements, leading to the shutdown of the Florida HIE free direct service in 2014. 3 years ago, I shared in that ONC video, as we looked at the opportunity, we didn't believe we could be this far, this quick. Looking back and around today, what I share is, I can't believe how quickly all we built was blown away by the storm. But sometimes, when you fall in love, it is difficult indeed to just walk away, hurricane or not. That is why last year, with the help of my very dear colleague, Dr. Christopher Sullivan, and a dedicated practice advisor, Miss Ramey Dick, we took a deep dive study into the Florida landscape to see where HIE, such as direct, is today. We documented 260 Florida ambulatory physicians in a wide range of critical care roles. We established an interview methodology around relationship management and recruited anchor physicians and captured their technology and referral information. We then researched those referral providers and outreach to them and documented in detail our findings, which were then shared with the anchor physicians. Based on adoption data from the Florida HIE, we focused on 3 main geographic areas of Florida, which included Miami-Dade, Tampa, St. Pete, and Sarasota, and Jacksonville and Northeast Florida. 1/3 of the practices were small providers of 3 eligible professionals or less, using over 30 different EHRs. Some of the results? Well, similar to the national average, 88% of Florida ambulatory physicians have adopted electronic health record systems. 83% of those were certified technology. 50% were meaningful use participants, while we found that 40% did have access to direct, regardless of whether they were a meaningful use participant or not. However, only 42% of meaningful use providers had implemented direct. So how best to summarize the rest of the study findings? Well, with the word of 2 of our anchor physicians. Dr. Chris Pittman practices in Tampa and has been an HIT leader over the last several decades. He has chaired many of the efforts of the Florida Medical Association. What Dr. Pittman shares should be simultaneously telling and chilling coming from the physician that led the FMA HIT Advisory Committee after many weeks of trying to get his direct implementation to function. Walt, thanks. I don't even know how I would send the message. This really speaks to how EMRs have no interest in information exchange. Silos seem to rule. If I'm struggling like this, and I am very motivated to do this, a rank and file physician doesn't stand a chance. And then we have Dr. Janet Betchkel, who practices here in Jacksonville. Not only is she a maven in her field of ophthalmology, I am blessed to have her as my physician. Over many years, I have witnessed firsthand, through my sometimes multi-purpose visits, her HIT evolution challenges and success. I am a patient that has benefited from her highly digital practice, and yet here is what Dr. Betchkel shared. Since successfully adopting an EHR throughout my practice, one of the most profound challenges continues to be securely sharing information with my colleagues. Many of us are meaningful use participants with direct messaging, yet we cannot seem to successfully exchange secure email. As we analyzed the study findings, it was clear that ambulatory providers still continue to rely almost completely on fax communications. Most direct implementations appear to be narrowly developed around the meaningful use HIE objective and did not easily enable direct for other use. But as we also discovered, direct is more deployed than expected and has an untapped potential to be more widely available and usable. How to move forward? Well, revisit the past. Everything that I shared about how the Florida HIE accomplished such success from 2011 to 2013 is as relevant and doable today as it was then. Rather than continue to allow a capability with the potential of direct to languish, the opportunity given the dire need to securely connect healthcare and move beyond the data silos and towards a learning healthcare system is to re-engage direct deliberations and CMS leadership. That is the focus of the third section of the presentation, refocusing the Swiss Army knife of HIE. As PC World lamented, healthcare is one of the last bastions of the use of the fax machine. Go figure. One of the biggest reasons is not just the availability of fax and its consistency of execution, but all that unstructured data and paper that is still communicated every day and will be for some time to come within our healthcare system as it digitally evolves. There can be no denying of the doubt of the opportunity of capturing and exchanging discrete, actionable data that builds towards a learning healthcare system. But let's not continue to let the perfect get in the way of the good. We must recognize the reality of the landscape with which most ambulatory physicians and other healthcare providers often operate in today. Just as we did during those days of e-prescribed Florida, recognize the need for incremental capability that helps physicians advance up the technology staircase of adoption. Again, this is one of the beauties of direct. The ability to be able to be used today by those just getting started, all the way through those who have very advanced implementations, and the ability to connect everybody in between, regardless of what step they're standing on. In conclusion, there is no question direct represents a highly flexible, extensible, and secure capability with the potential to foundationally and transitionally connect all healthcare stakeholders. However, in my humble opinion, based on all my experiences in study, especially over the past half dozen years, it is going to take an enhanced CMS leadership and, as importantly, its own use of direct. Leverage what Florida did and how. Bring about a refocusing of the direct education, marketing, and use cases. Re-engage critical stakeholders with actionable dialogue and planning, leading to more efficient and effective direct utilization. Now, having said all that, and finally, I would like to thank the team at Connecting Healthcare and those that participated in the study as our anchor physicians. Most importantly, Dr. Betchkel, Dr. Pittman, Dr. Alaya, Dr. Santander, and Dr. Swartz. And I would also like to thank all of my dear colleagues from the Florida Health Information Exchange, the Florida Agency for Healthcare Administration, Harris Corporation, and Audacious Inquiry. While the views expressed in this presentation are, go figure, mine, all that was accomplished was done so through the teamwork and dedication of an extraordinarily talented team. Visit the Connecting Healthcare website and download the presentation and the relationship roadmap tools we created for use in our study. You'll also find other free educational information, training, and content about HIT, and let's not forget about HIPAA. Thank you for taking the time out of your very busy day to listen to this discussion, and please join me for the Direct HIE movement. Please do contact me with any questions or suggestions. I'd love to hear from you. And today and every day, make it a connecting healthcare kind of day. And thank you again.